We are MakilalaTV, the first Filipino-American TV talk show in the New York metro area. Get to know us as we talk to the community leaders, innovators, advocates, and emerging artists who affect Filipino-American life.
Hello, my name is Cristina Pastor. On behalf of my co-hosts, Rachelle Ocampo and Gabriel Garcia, welcome to MakilalaTV, the longest-running Filipino-American talk show in the U.S. Filipino nurses in the U.S. are considered world-class. There are many reasons why this is. Their nursing education is similar to the U.S. system. They speak English. They are known to be hardworking, compassionate, and nurturing. And they have a manner of speaking that is soft, reassuring, and gentle that many patients find very comforting. But many Filipino nurses who have long served with dedication are approaching retirement. Demographics shows an aging nursing population. A new generation is stepping in to take their place. Two of them are with us today, Quimberly De Leon and Dr. Patricia Po. Quimberly is Director of Patient Experience at Mount Sinai Hospital, the Joseph Cullman Jr. Institute for Patient Experience. She brings over a decade of nursing expertise, creative innovation, and transformational leadership into her role. Patricia is an accomplished physical medicine and rehabilitation nurse practitioner at Hackensack Meridian Health. She has an 18-year nursing career spanning from pediatrics to geriatrics. These are just the kernel of their bios. Their bios are actually longer and full of impressive credentials. Welcome to Makilala, Kim and Patricia.
Thank you. Thank you for having us.
Yes, thanks. Let's start with you, Kim. How are the young nurses doing in the workplace?
We run the world.
Wow, what an
also,
understatement.
because majority of the workforce are actually millennials. And
Already?
Yes, and I myself I am a proud millennial, and we're actually I think we're very excited about the future, about the advancements in technology and all of that stuff. So we're doing perfectly fine.
I know. We're going to talk about technology later.
Yes.
Patricia, are the younger nurses getting along well with the older generation nurses?
I think so.
Really?
I think we're working together very well in the clinical settings. Yes.
Okay.
We learn a lot from them.
Okay. Do you call them tita nurses or something? Or auntie nurses?
At work, we are trying to be more professional. So we try to avoid calling each other tita, tito,
Tito,
ate,
yeah,
kuya. We try to call each other miss.
Oh, really? Yeah. So,
Our other nurses prefer to be called with their first names. So it depends on, like, the person itself.
yeah. So they are, what do you call this? Bringing you up to speed on what to do. They are mentoring you. That's the word I was trying to recall. They're mentoring you. Okay.
Yes.
Very
Yes.
good. Yeah.
All the time.
All the time. So, Rachelle?
And we love it.
Yes. No, well, when you mentioned you work together so well.
Yeah.
But what are those challenges between the millennials and the more senior nurses? What are the differences that you kind of clash?
I think sometimes there's like a misunderstanding with like how we deal with them, or like we like to text, and or sometimes like the way we converse with each other. Sometimes they misunderstand it, or the younger generation misunderstands them because they are very direct.
Oh.
Yes. So usually
very direct by way of speaking?
Yes.
Okay.
Yeah, usually like older or senior nurses, they are very direct when they speak to you. So younger nurses might feel like, oh, they're kind of harsh, but sometimes it depends also on how you perceive things. So it's also, depends on the person.
Is that also your observation, Kim?
I have, so it varies. I think in general we get along really well because they're very nurturing,
Mhm.
and part of that desire for them to nurture us also comes the tough love, which we appreciate because it helps us catch up a little bit faster with stuff. But also I find them very open to us as well as to what we can offer in the units or in the workplace.
Mhm.
So I know that both generations are adjusting with each other, but I like what I see because we are just there for one another. I think the pandemic made us closer. The pandemic really built a lot of more bridges for the generations. So
Gabrielle?
Yeah, I got to watch Nurses Unseen, and oh my gosh, I was crying the whole time.
Just
Right?
Oh,
Yes,
So
but you guys are truly amazing, like such heroes. But I was curious, like, what was it like to like be in the pandemic and be at the front lines?
I can go first. Okay. So I became a manager April 1, 2020.
what
which
a
was-
magical
yeah.
time.
Wow.
That's
Yeah.
like 2
Mhm.
weeks when the city was on pause.
Yeah.
Remember when it was just a pause?
Mhm.
Oh my
2020,
God.
yeah.
Yeah, 2 weeks after.
Yes, and the promotion came way before the pandemic, but because of staffing, I needed to wait a little bit. And my first task on my first 2 weeks in management was to help build a unit. We transformed our cafeteria into a COVID unit, which has telemetry capability, negative pressure, all of that stuff. So I needed to learn fast, and I'm very grateful again to our mentors who are boomers and who are Gen X, because they really were generous with what they have to offer, and so it was a time when I was basically just tapping into all of the things that I was taught to do. And we were able to build it in 2 weeks. And here I am, still in leadership, still loving it. It's been 5 years.
Yeah.
But it
Is it for the same hospital, Mount Sinai?
it's different.
It's a different
It's a different hospital, but both hospitals have been amazing.
What about you, Patricia? Where were you during COVID?
Oh, during COVID, it's a very tough time for me
Mhm.
because I was working at subacute rehab.
Oh.
And that time, a lot of our patients died, unfortunately.
Subacute would mean nursing facilities.
Yes.
Okay.
So it's a skilled nursing facility.
Mhm.
Yeah. So it has a subacute rehab and it has a long-term care area as well. So at the time I was working in a subacute rehab unit. And unfortunately, as I mentioned, a lot of our patients have died from the long-term care facility, from the unit, I mean.
Mhm.
So it is a very tough time. We were struggling, a lot of us. A lot of my coworkers also got sick, but thank God I did not get sick at all. And then at the time, I was also in school for my masteral.
Oh,
Yes. So,
wow.
yeah, I was going back to school at NYU, and it was kind of tough at that time too. But so it was our assessment class, I think, and then I was like, oh my gosh, it's so bad because then I should have been in school. I would have been doing it in the skills lab, but at the time I was doing it with a teddy bear. So I was like so mad. I was like, how can I learn from this when I'm doing it in a teddy bear?
Because you
have
were
come a long way
Right.
since.
Yeah, because you were in training, right?
You're right.
So, are Filipino nurses, is there still a big demand for us
Oh yes.
in the US?
There will always be a demand
Oh,
for
yes.
nurses in general, and Filipino nurses also. I think it's a natural. It has become natural. I didn't want to be a nurse. My parents forced me to be a nurse.
Oh, God.
I had other
Oh.
dreams for myself. I wanted to be a lawyer. I married one instead.
Okay.
So
There
it's a good.
So, why didn't your parents want you to be a nurse?
They said it's the passport to the American dream. So I was
That's how they
always-
sold it.
Yeah,
Yeah.
I was always
That's right.
destined to be here.
Mhm.
So I was always resenting it. Like in the first few years in nursing school, I was resenting it because I was afraid of blood.
Yeah.
I would struggle a lot. But then I think one thing that really drew me to it, and I didn't quit, I didn't transfer to another course.
Mhm.
I think what drew me to it is the human interaction. It is a profession where you express kindness, and that's the work that you get to do every day. I think that's what drew me to it.
So, you studied nursing here or in the Philippines?
In the Philippines.
In the Philippines.
So I think it's the same for a lot of us
Mhm.
in the Filipino community, and it's very natural for us to take care of each other.
That's right.
And to do that for a living is quite amazing.
That's right. Rachelle?
Tell us a little bit about the term patient experience, because as a director of patient experience, what does that really mean, and how did you grow into that role?
So patient experience encompasses all of the touch points of patient care. It's from appointments, from interactions with each and every person that works in the organization. So it is everything, each and everything that they experience. And so it's actually an honor to have, it's great to have a nurse to be sort of providing direction for the human experience, because that is exactly what we're taught to do. So patient experience is like whatever you can think of that a patient touches or sees or feels or hears, that's patient experience. And who else is a better fit for the job but a nurse,
But
right?
a nurse, yeah, that's right.
A Filipino nurse.
So Kim, did you ever do bedside nursing?
Absolutely.
In the Philippines?
You have to.
You have
Oh,
to,
not in
huh?
the Philippines,
Oh, here.
but in the US, yes.
And I know that you have, right? Because you were in a subacute facility,
Yes,
right?
yes.
Correct,
I
yeah.
did bedside nursing in the Philippines and here as well.
Oh, you also did in the Philippines.
Yes.
Okay, that's right.
Yes.
So when I talk to older generation nurses, they tell me, I get this a lot. Ay, magre-retire na lang ako kasi I don't want to study technology and computers. Do you hear that a lot?
No.
I leave that to the
Oh.
I leave that to the younger generation. So they go into retirement. Even if they're not, they can still work a couple more years.
Right.
But they'd rather do early retirement. Patricia, any
I
reaction?
hear about that one too before, because my facility changed from pen and paper to computerized.
Yeah.
So I
Yeah,
was
yeah.
one of the pioneers for that one
Mhm.
back in our facility. But then I hear that a lot from
Yeah.
the older
From
people.
from the senior
The
nurses.
senior
right?
nurses.
Yeah, I hear that a lot too.
Yes, the boomers and the Gen X.
Yeah.
But then, we always try to become troubleshooters for them.
That's right.
So then they were able to acclimatize to the computerized
I think it's all
system.
over the workplace, right? But when I hear them complain about it, parang there's some kind of resentment. Like, oh, sige sila na lang. Parang ganun. Parang they don't want to, hindi ko naman generalize. Some of them don't want to learn anything new anymore. Right, like computers.
Right.
Any reaction, Kim?
I think it's because when I became a nurse, we were already doing electronic medical records. So I didn't see
really?
the transition from.
Oh, we were transitioning.
I think you're a tita also.
Yeah, I think so.
I mean, in the Philippines, yes, it's still pen and paper. But here, Really?
Oh, Kim, you did not work in the Philippines?
No,
Okay. you
not
started
not
here.
as a nurse.
Oh, okay.
Yeah, I didn't. We were already. Oh my gosh, I forgot. It's Epic now, but it's something different before. But it has always been
Electronic.
Electronic.
Okay.
Yeah.
Yeah, the health center that I work for, we just transitioned to Epic like 2 months ago. So I am just like so crazy seeing all the staff trying to learn this new system. We've had another system before, but I had heard cases where there's staff that actually ended up leaving because it's just
Computerization.
it's just
Yeah.
is it really worth it to go
Yeah.
through all this stress
And
figure
to
it
think
out?
that the older generation nurses have already enough. I
Yeah,
mean, in
they've
terms
already
of
did their
money,
time.
you know,
Yeah.
But
I think
that
in
breaks
their
my
savings
heart.
account, in their IRA, in
Yeah.
their retirement benefits. So they're happy. They're
Yeah.
happy. They're
It
provided
breaks
for.
my
for.
heart because they are they are the most skilled in the workplace.
They are very
They have a lot
skilled.
to offer.
Yeah, that's
Yeah,
right.
they just need, I think, more support
Yeah.
from the facility,
Support.
from the
Yeah.
management.
We're
That's
here.
right.
So they just
Yeah.
need to work
Someone needs
for you guys.
Yes. Yes.
Gabrielle?
Yeah, I'm curious, like, on the conversation of technology, how is, like, AI coming into the healthcare system? Are you, like, excited about it, or you're like, oh my God, we need none of that in here?
I am all for it. So
Are you
it's-
working with it?
It
Okay.
might not be a popular opinion yet, but I have a lot of hope that we're going to embrace it as a community eventually.
Mhm.
I think for AI, one thing it does is it amplifies your abilities. It can never replace, human work,
Connection.
human connection. It cannot provide the heart of healthcare, which is nursing. Like there's there are things that are irreplaceable. And one very basic thing that I love is the Zoom minutes.
Zoom meetings?
Yeah,
Yeah.
when you record the
Zoom
Zoom
AI.
the Zoom meetings,
Oh, like summary.
it writes
Yeah.
the minutes for you. It summarizes it for you.
That's
So
right.
that
very
saves me
helpful.
about an hour and a half.
Yes.
Helpful
It
also for
does.
journalists. Yeah.
Yes,
Yeah,
yes,
an
yes.
hour and a half. And that's quite, and I can spend that connecting with the staff, connecting with the patients. Like it's a lot of time saved.
That's right. Any experience with AI, Pat?
Yes, actually, it makes it a lot easier for us as well. When we're looking for literatures to back us up when we prescribe things, or when we look into guidelines, sometimes it's too long, right, to read through all of it. But with AI, if you just ask one question, it give you a summary right there and then.
Yeah, that's right. That's
So-
what I've learned from
Yeah.
MJ Dia, MJ
Yeah.
Garcia Dia.
Yes. So
She deals with technology, right? Yeah.
right. So our attendings even love it. So yeah, we really embraced AI
That's
at
right.
work.
It really cuts short a lot of the
I
thing,
think
a lot of the
key-
work.
Yeah,
that you
the
do.
key to it is to involve us in developing AI.
Mhm.
Yes,
That's right.
yes.
You can't just develop it without the nurses.
What is a typical day for you like, Kim?
So in my new role, I actually have a personal rule to always round. In my role now, there's a lot of meetings, a lot of brainstorming, strategizing, all of that stuff. But I have a personal rule to never let a week pass without rounding, connecting with the staff, connecting with some of the patients. It's very fluid for me. But I like it because it allows me to be creative and to build more relationships in the midst of all the tasks that need to be done.
By rounding, you mean visiting patients in the rooms?
Yes.
Okay. Or just studying their charts?
No, I actually like the human connection. You can't let me be in an office for a bit because I'm a true extrovert.
Okay.
And I really enjoy talking to the staff and patients, and that's how you make good decisions as a leader. You have to stay in touch with the bedside.
But you also need the support of leadership, because say a staff member complains to you about the workflow of things not working that's not best for the patient's interest, you're going to need leadership support to be like, hey, I need financial resources to funnel to make this patient experience better. So I'm assuming that plays a factor.
Yes, one thing I love about my Mount Sinai is they don't tell you not to do things. Like you're free to dream, you're free to think big, and like there's no crazy idea, and that's why the advancements are there.
That's interesting.
Yeah.
Pat, what is your typical day like?
A typical day for me starts with a chart review of all my patients, talking to the nurses as to giving me updates as what happened last night, and then doing roundings with my attendings. And then after that one, then start doing notes.
Oh,
And
okay.
then giving a report again to my the next shift PA who's working for us as well. And then that's it. And then goes back again the next day.
How many
Same
patients,
routine.
How many patients do you do rounds with on a given day?
Mostly 10 patients.
Really?
Yeah.
Isn't that a lot?
No, not a lot actually.
Really?
I'm actually very, very lucky to only have like 10
10
10
patients.
A lot more.
Because
Yes.
my husband is in and out of the hospital after a stroke. And it's so hard to get a nurse. I wanted to get an
Sorry.
update and I couldn't find a nurse.
Um,
And then they tell me, oh, because she's with this and that patient.
It always seems like it is short-staffed.
Yeah, yeah,
There's
that's
just
right.
never enough
That's right.
support.
Mhm.
I think it's just because what a person cannot be in two places at once.
Exactly.
Yeah.
And I
I think
understand that.
Yeah.
Yeah, but sometimes a day goes by when I don't get to talk to a nurse. So I have to go again the following day. I'm always there anyway the following day. Right. So what has been your experience with patients' families? Pat, you want to start?
Patients' families, sometimes they're very easy to talk to, although there are ones that are kind of difficult.
I'm sure.
Patients' family.
How dare this patient after a day?
But I think once you explain to them, then there's understanding, and so then there's cooperation after that one.
That's right.
Right. So it depends also on how you manage them and how you explain things to them.
That's right. Kim?
we have a nursing framework called relationship-centered care. So you build relationships with patients, with their families, with each other, and the community. So part of the job, and sometimes one of the most challenging parts, is to build trust with the family members, and that's where patient experience comes in, because we train our nurses how to talk to our patients, how to make them feel that we are there for them, because the nurses are actually doing their best, right? How do we
They are. Yeah.
how does it come across to the patient? Like, how does the patient perceive their care? And that's why patient experience brings the voice of the patient, their perception of care, so that it continues to guide our practice. And so, yes, we deal with different family dynamics. Sometimes, it can be hard on the teams, and that's why it's important to have support, processes that will provide support for the nurses in dealing with some difficult conversations with family members. Having your loved one in the hospital is something that I don't want anyone to feel and experience, but it's inevitable. At one point, we're probably gonna have to be patient.
That's right.
And so, we meet where they are, and we ask them because the answer is actually from them. The answer to good care is from the patients and from the family members.
One thing I noticed though is that the nurses rotate, right? You don't see them every day.
Right.
You talk to them Monday, the following day it's a different nurse, right? So
That's true.
somebody gives you another set of evaluation. So after you've established a rapport with one nurse A, nurse B comes the following day, and you have to establish relationships. Go ahead, Gabrielle. I just wanted to.
Well, I actually had a question, because I'm trying to see the dynamic of the more senior nurses and the millennial nurses that are coming in, and like the time frame of how long you end up staying at a job versus these decades long seniors who have been there for really their
that's
whole,
right. I think some nurses like the bedside part of it, because the connection is more intimate with patients, right? And there's some nurses that wanted to advance away from the bedside part.
or they get burnt out. One of my best friends, literally that's what ended up happening. Like they were just asking so much of her because she was so good that they just expected too much, and she's just like, this is too much for me. So she had to decide to leave, but she is planning to come back. But
Thank God.
We need her.
Yes.
The workforce need her.
So how have you seen that trend of like the younger generation switching jobs to jobs versus the older that kind of stay in one place?
Yeah, I think I see that a lot too where I'm working, because senior nurses or boomers and Gen X, they are into loyalty.
Loyalty
to the facility,
Okay.
especially if that facility was the one who petitioned them to come to work
I've met some
to the US, right? So
and they rise through the ranks, right?
Right, exactly. But for younger nurses, like the next gen, I think we are into flexibility.
Yes.
That's our
Yes, we are.
Yes.
So, and then also they want easy job and easy money too.
Is it right?
I think that's what it is.
Yeah,
right?
I'm sure.
Yes.
Okay.
And then also, I could see that now, even in school, when I was in school, I feel like I was one of the older ones already, because all the younger ones are there back in school from their master off. But I went back to school like 10 years after
your bachelor's.
Yeah.
Okay.
So it or 10 years of experience here in the US. Then that's the time I went back to school. But I see these young nurses after 2 years of being at work, then they go back to school right away for their masteral. So
they kind of just want to
yes,
get it over and go to the next
go
one.
to the next one.
Yeah,
So how long
It's so competitive.
how long does a nurse stay a bedside nurse, generally speaking? 5 years? Is that too long as a bedside nurse?
Well, nowadays for our generation, I think it is.
It's too long.
Wow.
Yes.
Okay,
Interesting.
2 years long to go to 5 years.
Yes.
Is
Yes.
that
Gabrielle,
because
you have a
of
question?
The
Yeah.
burnout, or just the change?
Yeah, sort of also that, they say when we are at bedside, they ask for so much from us.
They meaning the hospital or the relatives?
Patients like you. Patient's family.
Families
I
or
think
the-
in general, you know,
Yeah.
yeah.
I
There's so
think-
much documentation
Yeah,
and
it's a lot.
too many patients.
Too many patients.
They feel like it's not safe for their licenses
Oh,
because
okay.
you know they have too much patients to take care of.
Yeah.
So yeah.
Yeah.
So there's
You know,
so
one
many
more point.
reasons.
I didn't know until my husband had a stroke that I thought patients would be the ones taking care of the cleaning
Bed
up.
bath.
Yeah,
Yeah.
ADLs.
I didn't
activities of daily
know.
living.
I didn't know. So I was calling a nurse to take care of my husband, and they had to call an aide. An aide actually does it, right? I thought it was a nurse. Gabrielle.
Yeah, I'm curious. Since there's so much that is expected of you guys, like what makes you guys stay in nursing and stay in the healthcare system?
Good question.
It's a very millennial answer because
Let's hear it.
yeah, millennials actually. I just wanted to it's a nice it's a nice transition, but millennials also leave jobs that they think are not contributing to a mission that they agree with. So and now my answer is it's because it's a mission. It is I don't know at this point what else I would want to do, which was such
If you're not a nurse.
yes, I can't believe my mom forced me into it. I think she knew that I would love it. But yes, it is the ability to be there in the darkest days of anyone, the most scary
Mhm.
experience for anyone. It's being the hand that they hold and basically the light in their day. And you know, that's the beauty of nursing.
I'm
And
so sorry, Kim.
Yeah.
We have to cut short the
Okay.
program.
No
So
problem.
thank you, ladies, for a very enlightening and very engaging interview. You know, my husband has been in a hospital because of a stroke, and he's been to 4 hospitals, and in all those 4 hospitals, I've met all the Filipino nurses from all generations. Okay, I noticed that the younger nurses have longer hair. Okay, and the older
Kind of true.
senior nurses and the senior nurses have shorter hair, and I see the longer hair in Kim and Pat. Okay, that's a shallow comment
Haba
for
ng
now.
hair.
That's a
Haba ng
shallow
hair.
comment to end the show. Thanks, Kim and Pat, for joining us, and congratulations on your dancing career. And from the looks of things, it looks like healthcare is in good hands. And to all our viewers, thank you so much for watching.